This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is Duchenne Muscular Dystrophy? Answer: Duchenne Muscular Dystrophy is an X-linked recessive disorder that typically occurs due to frameshift deletions or nonsense mutations, which leads to truncated or absent dystrophin protein, resulting in progressive myofiber damage. Question: What are the symptoms of Duchenne Muscular Dystrophy? Answer: Weakness begins in pelvic girdle muscles and progresses superiorly. Pseudohypertrophy of calf muscles due to fibrofatty replacement of muscle. Waddling gait. Onset before 5 years of age. Dilated cardiomyopathy is common cause of death. Gowers sign. Patient uses upper extremities to help stand up. Question: What causes Duchenne Muscular Dystrophy? Answer: Duchenne Muscular Dystrophy is caused by the deletion of the dystrophin gene, which is the largest protein-coding human gene, leads to increased chance of spontaneous mutation. Loss of dystrophin leads to myonecrosis. Question: How is Duchenne Muscular Dystrophy diagnosed? Answer: Increased CK and aldolase. Genetic testing confirms diagnosis. Question: How does the loss of dystrophin affect muscles? Answer: Dystrophin helps to anchor muscle fibers to the extracellular matrix, primarily in skeletal and cardiac muscles. Loss of dystrophin leads to myonecrosis. Question: Is Duchenne Muscular Dystrophy the only disorder that presents with Gowers sign? Answer: No. Gowers sign is classically seen in Duchenne Muscular Dystrophy, but it can also be seen in other muscular dystrophies and inflammatory myopathies such as polymyositis. Question: Is there any treatment available for Duchenne Muscular Dystrophy? Answer: Currently, there is no cure for Duchenne Muscular Dystrophy. Treatment options include physical therapy, steroids to slow muscle deterioration, and heart and breathing support. Gene therapy and exon skipping therapy are also being researched as potential treatment options. Question: What is the expected life expectancy for someone with Duchenne Muscular Dystrophy? Answer: The life expectancy for someone with Duchenne Muscular Dystrophy is typically into the late teens or early 20s. Dilated cardiomyopathy is a common cause of death. Question: Is Duchenne Muscular Dystrophy more common in males or females? Answer: Duchenne Muscular Dystrophy is more common in males as it is an X-linked recessive disorder. Females can be carriers of the disorder but usually do not display symptoms. Question: Is there any way to prevent Duchenne Muscular Dystrophy? Answer: There is currently no way to prevent Duchenne Muscular Dystrophy. Genetic testing can help identify carriers of the disorder and allow for informed family planning decisions. Question: How does Duchenne Muscular Dystrophy affect the heart? Answer: Duchenne Muscular Dystrophy can lead to dilated cardiomyopathy, which is a weakening of the heart muscle that causes it to stretch and become enlarged. This can cause the heart to pump less efficiently and can lead to heart failure. Question: Can Duchenne Muscular Dystrophy be diagnosed during pregnancy? Answer: Yes, Duchenne Muscular Dystrophy can be diagnosed during pregnancy through chorionic villus sampling or amniocentesis, which can detect the genetic mutation associated with the disorder. Question: Are there any clinical trials available for Duchenne Muscular Dystrophy? Answer: Yes, there are ongoing clinical trials researching new treatment options for Duchenne Muscular Dystrophy such as gene therapy, exon skipping therapy, and stem cell therapy. Question: How does Duchenne Muscular Dystrophy affect the respiratory system? Answer: Duchenne Muscular Dystrophy can lead to weakness in the muscles used for breathing, which can cause breathing difficulties and an increased risk of respiratory infections. Question: Are there any support groups or organizations available for people with Duchenne Muscular Dystrophy? Answer: Yes, there are several organizations and support groups that provide information and support for people with Duchenne Muscular Dystrophy and their families, such as Parent Project Muscular Dystrophy and the Muscular Dystrophy Association.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.